Hello, hello, ladies and gentlemen, and welcome to another episode of the Daily Friend Show. I am your host, Nicholas Lorimer, and today I'm joined by Mr. Terence Corrigan. Terence, how are you, sir?
Freezing.
Very much the same here, and also by Mr. Michael Morris. Michael, are you also freezing?
A little warm, actually. I mean, it's sunny and clear here today, but I believe it's snowing where you are.
So
Well,
this
it was
morning there was
earlier. We got
in Joburg.
we got Cape
There
Town
was
secondhand weather.
Okay.
indeed.
I'm sorry. Sorry about that.
This morning in Johannesburg there was a light dusting of snow that I woke up to, and there is currently cold air outside blowing through the trees, and it is just generally a freezing day. I think it's one of the coldest days in a long time. I think the last time we had snow in Johannesburg was 2012. So this is rather unusual. Not a lot, mind you. I think some parts of the city got more than others, but where I am, it was pretty much all gone by the time it got to the ground. Anyway, unusual freezing cold weather. So let's talk about a topic that sends a chill down my spine, and that is the national health insurance, where there's been this big public pushback against the national health insurance. It went through Parliament quite unexpectedly. It had sort of dragged its feet through the legislative process for a while, and then suddenly it was through into the parliamentary process and passed. It's still not done through the legislative procedure, but it's on its way. And this, I think, shocked quite a lot of the sort of mainstream of South Africa's opinion, who had thought that NHI was never really going to be implemented because it was so expensive, or maybe they thought that it was going to be significantly modified. I'm sure there were some of the medical aid companies that had that view. But anyway, it got this big backlash, and now its prime architect, Nicholas Crisp, has come out in defense of it. And he gave a long interview not that long an interview, but he gave an interview to Alec Hogg, where he kind of suggested some reasons why NHI wasn't really the thing that everyone was so should be so worried about. He's referred to the opponents as running an Operation Fear, that it's all just vested interests trying to stop the reorganization of our healthcare system. He said the structural issue in how healthcare is purchased, both in public and private sectors, are not functioning optimally. The media tends to focus on the private sector, but it's worth noting the majority of NHI's bill's content is centered around restructuring our public sector. He says that the bill seeks to centralize far more decision-making with the minister, and that this will improve accountability and management. But he also says that there will be an element whereby individual hospitals will get more authority to determine certain things. He goes on to say, when asked about the effect of cadre deployment and political interference on the managing of the healthcare system, he said, regarding cadre deployment, I prefer not to comment on politics as I have no involvement in that sphere. However, I can discuss management in the public sector. Studies have been conducted to understand the underlying problems, and political interference is one factor that hinders effective management. Even if a competent individual is deployed, interference and changes in political leadership can disrupt operations. This is a widely acknowledged challenge within the public sector, and it's difficult to prevent such interference. The plan currently in progress, including those related to the National Health Act and the NHI, aim to tackle these challenges and provide a framework for improvement. It won't be an easy or quick process, but it will set the stage for positive change. Not really sure how that will happen, but anyway. He also talked about how there were too many medical aides and too many administrators. And so he sort of made this it was quite a brief comment, and he wasn't challenged on it, saying, we may transition from 72 medical aides to 5 or 6, streamlining administration, simplifying the process once NHI is implemented. So the implication there being that less competition in the medical aids space. Terence, let me start with you. What did you make of this interview? What do you make of the way the debate is unfolding on NHI currently?
Look, let me just say, as an opening shot, that I've got a great deal of respect for Alec Hogg, and I really like the business platform. But I think that he rather let himself down in this interview. I think that Nicholas Crisp actually didn't come across too badly. But I think also most of the most important issues were just unaddressed. Now, I'm referring specifically to the interview. I think that some of the points that Chris made about administration costs and in medical aids are valid. But the sort of kernel of the issue, I think, just sort of eluded that discussion, and it's this: that this would, in Crisp's words, would entail a centralization of funding. This interview is that it's not just funding currently within the government, currently being performed at various levels of government, but it's also the idea is to take money that is being spent voluntarily on the private sector through those private medical aids, centralize this, in a structure where ministerial discretion seems to be, fairly heavily concentrated. That's one of the criticisms that it's encountered, even for people who are quite sympathetic to the idea. And that will then create a monopsony. Now he says it's going to be great because it's going to reduce costs. Well, two things I think were not addressed. That monopsony will then presumably come loaded with all the government sort of extras and bells and whistles in terms of empowerment partners and cutting in the cadres. I think it's highly disingenuous for somebody to say that you're going to make this sort of shift around, and then say, well, I can't really talk about cadre deployment because that is fundamental to the way the ANC has structured the state. President Ramaphosa, one of the few things he's ever become animated on is that we're not going to change this. In fact, when words recorded by the Zondo Commission, this adds another layer of accountability to our state. So take away cadre deployment, and we'll fall into this morass of corruption.
Good Lord. It's a little bit like saying, bubonic plague is not that bad if you just ignore all the things that kill you.
Exactly. Yeah. So okay. So that's the one thing. And then, of course, there's just sheer corruption. And I keep on repeating this, and I don't know why this isn't going viral. You see, things should go viral when I say them, but maybe I'm not on Twitter, so they don't go viral. It's this: the NHI is conceived as a state-owned enterprise whose only function will be to collect and spend money. I don't know. Must I draw you a picture?
Well, just on that point, as perhaps an illustrative example of the current state of the SOEs, let's just quickly look over the SABC, which the Sunday Times said is looking at a loss of 1 billion rand over the weekend. Except instead of putting on soap operas, this will be your healthcare that the government will be running into the ground.
Michael, think it was quite good actually at one stage.
Maybe at one stage, and I'm sure there's still talented people now making things in the SABC, but a lot of SABC programming is not that great. Anyway, Michael, there's a sort of larger philosophical argument about NHI, which is that how much of a role should the state actually play in the provision of healthcare? How centralized should a healthcare system be? Stuff like that, but. And I have very different views from the government of that, although I do think there are more reasonable arguments for having state intervention in the healthcare sector. But be that as it may, that's really kind of missing the point here. That's like playing in the clouds when we've got the much larger problems, as Terence has just pointed out here, of just the fundamentals being that we cannot trust the state to manage this much money. It will become the largest political patronage machine in the country, and whoever the Minister of Health would be empowered to hand out, favors and money and spending to an unimaginable degree. I don't know. What's your take on this?
I agree with everything. It's kind of key points that you've all raised, but I want to go back to one of the things you began with, Nicholas, which was the kind of surprise, the public surprise that this thing has, finally been approved. It's gone through Parliament. That MPs have actually said, yes, we want this. And this is a bit of a pattern. We've seen it with expropriation legislation, which Terence has written a great deal about. We've seen it with virtually in every sphere of ANC policymaking. We've seen this pattern where something which is generally among intelligent people regard it as unworkable, or perhaps just in a too raw a state to even be considered a kind of rational policy, crammed into a bill, and before you know it, it's gone through Parliament, and then we hear that it's going through the National Council of Provinces, and it's bound to be challenged there, and questions are going to be raised, and lo and behold, it'll sail through there too. And it's a bit surprising that there is any surprise anymore. This is actually what the ANC is its praxis is. And in fact, what we're looking at here is a sort of massive interference with the way we live our lives and the way we choose to live. Moving on to the second point that you raised is, the other ways of looking at this. And there is a sense, I mean, I grew up with just anecdotally, if I just mention this very briefly, my mother was a theatre sister, trained at the Gloucester Royal Infirmary. She served in the guys in St Thomas's Hospital in London during the Blitz. Her mother was a nurse in Queen Alexandra's Imperial Nursing Corps. So I grew up with this when my mother came out to South Africa in the 1950s and married and had us, well, before she had myself and my brother, she worked for Bantu Health, actually, for a TB isolation hospital. And so I grew up with a sense of medicine, public health being a kind of service. There was a whole ethos of, this is quite a legitimate thing that people do because they have almost a calling to do it. They care about other people and so on. But the proviso is, and this comes back to Terence's point and the point that you've made too, that these things are run in a context of honesty, sound management, basic application of rules and medical protocols, and there's a kind of strictness, there's a discipline, there's a proper way of doing things, and that's the measure. And so if you look at South African healthcare, I mean, we have a very considerable public health care sector. It's massive, and it with millions of rands, hundreds of millions, I don't even know, but hundreds of millions of rands spent on it every year. And it's just badly run. That's actually what the problem is. The skeletal structure perhaps is there. We just need to avoid the cadre deployment that Terence mentions and the corruption that both of you have mentioned. If we can deal with those things and confront those, and so in that sense, it's completely unacceptable for somebody like Dr. Crisp to say, "Well, this is a political question. I'm not going to deal with it," when it is in fact fundamental, as we saw in fact during COVID, when there were specific promises made that there are going to be measures to ensure that corruption does not occur, and lo and behold, there was on a massive scale. So yeah, it's not a very convincing picture, unfortunately.
No, definitely. Terence, do you have any final thoughts on this? It strikes me as, I think in many ways NHI is actually one of the greatest threats to the functioning of South Africa, because I believe fundamentally that it's clear that it will hurt particularly middle class people, and I'm not just talking about the sort of stereotype of white suburbanites or something that the media seems to often view middle classes to mean, but I'm talking about the majority of the middle class who are actually lower income Black South Africans who are still professionals. They work in government, maybe they work in the private sector, who have just managed to climb out of the public healthcare system. And those people, I think, if they have skills, are probably going to try and leave if they now suddenly have the government determining which hospital they can go to or what benefits are covered. Your thoughts?
Yeah, look, I think that one of the big ironies of this is that I think one of the most immediate losers will be civil servants, and the civil service has been probably the greatest forum for socioeconomic mobility for Black people. Now, whatever weaknesses it has, and we can talk about those for hours and hours and hours. In terms of of elevating people into a solid middle class lifestyle, it's done that remarkably well. I think that probably the first thing on the chopping block, before your discoveries or whatever, will be the government employees medical aid scheme. I think that will be the first one to be collapsed, and then you will be on the NHI. parting shot out of the gate. I think, interestingly, it'll probably hit MPs and legislators too. I think as you go further up the food chain, you start to do what is, what is possible in many dysfunctional developing countries. You have sponsors or you have the state that will pay for you to go and get proper medical care elsewhere. It's interesting how many African heads of state have died abroad. There was a Nigerian president. I understand, his merely parking his plane in London was costing the Nigerian state millions of pounds. And apparently, in 1 year, he was there for, I think it was Buhari, he was there for, I think, effectively 6 months of the year. Look, there will be certain people who can escape it. But, I would just like to remind everyone what I think Dr. Crisp was allowed to get away from is this. He said, well, okay, after you're on the scheme, we will pay you, we will cover certain conditions, and you will then go to your doctor and there'll be no out of pockets and all, it's all great, because I do think there are real issues. I think it is scandalous that somebody who, dies because he or she can't afford, let's say, insulin for diabetes or whatever. These are conditions which I think should be, which I do think society in broad terms, has an interest, and I would say a responsibility to assist with. But then, okay, but if we don't pay for that, well, then you're then welcome to go on with the medical aid scheme you have. However, the whole plan is to take the money that you are spending on that scheme now and put it in. So yes, just top that up with another 5-6 grand or whatever, and you're on your way. Now, maybe
Right.
for someone like Dr. Crisp, you have that kind of money, but the vast majority of the middle class does not. So it'll be
That's exactly the point, is that it will actually create a kind of inequality where you will have a very small selection of the super elite who are able to have these extensive medical aid packages that are very expensive but cover the rare conditions that are not covered by NHI. And if you are even sort of middle class or poorer, and you get anything that's even a slightly rare disease, good luck, because NHI will probably not help you out. It's my prediction.
Or you will there will be
Waiting
unaccredited facilities in the country which charge strictly cash.
Mm.
There will be a blesser, a sort of latter-day doctor who will pay for you to go and spend 2 or 3 months in a private clinic in New York.
Right.
Capitalist medicine having its advantages. Or perhaps a sympathetic government like Cuba can take you and treat you in the same in the clinic where its political elite gets their treatment. Or you could possibly have a military hospital. That's what P.W. Botha used to do.
Right.
Which all of which says this for me, that for thee.
Yeah.
And for me, I'm okay. You not so much.
Yeah.
So yet another attempt to eliminate inequality in our society is likely going to entrench it. Anyway, let's move on. Speaking of that, let's move on to our next topic. And this is coming from the president's weekly newsletter. So every week there's this newsletter that comes out from the office of the president, from the desk of the president, and it talks about a variety of issues. We sometimes cover them on the show. This week, President Ramaphosa defends the social grants system. Well, sort of. He kind of basically defends government spending on public services, which is, I think, he's kind of trying to fudge the issue a little bit here. But anyway, he goes on to say that since the advent of democracy, we have dedicated great efforts and resources towards alleviating poverty and reducing inequality. This is through substantial social protection programs. Government has been provided vital support to millions of South Africans, lifting many out of extreme poverty and meeting many of their basic needs. He goes on to say that the funds spent on social protection are not wasted. They make a real difference in people's lives, both now and into the future. But social protection in South Africa goes far beyond the provision of social grants for the elderly, children, people with disabilities, and military veterans. It goes beyond the work of the Unemployment Insurance Fund, which provides income support for unemployed workers, or the Compensation Fund, which supports those involved in the workplace accidents. It encompasses all support provided to South Africans, mainly the poor, through which it has become known as the social wage. This includes provision of free basic services, healthcare, basic education, higher education, social housing, and transport. When debt servicing costs are excluded, I wonder why they're excluded, around 60% of government's budget is spent on the social wage. And he just goes on to talk about the sort of idea that the social grant system, firstly, can't be isolated from the provision of something like government healthcare or government education. But beyond that, that it creates the conditions by which someone can escape the so-called poverty trap, which is where you're so poor that you can't ever seek out proper opportunities to escape from poverty because you're so busy dealing with your day-to-day needs. Michael, what do you make of this? So I think in the way the president has put this argument, it sounds more reasonable, but I think it's kind of fudging things, which is that, when you get a sort of 350 grant, when you get the child grant, it's not really creating any kind of better future for you. Maybe it allows you to buy food, but that's kind of about it. It's not particularly sustainable. What are your thoughts on this?
I think, I mean, I didn't speak for Terence, but I think Terence and I are probably more or less on the same page about the importance of providing a basic relief for the millions of poor people we know are out there. A lot of them are invisible, but the statistics tell us just how serious the position is. And there's nothing fancy about that argument. It's a very plain one about compassion for society and so on. But I think a key thing is that there's no grants, no amount of spending that the government can do that will ever be a substitute for economic policy, or even spending money on policy initiatives that are going to create jobs, that are going to enable people to be the agents of their own improving lives and seeking a stake in the society. There was a very interesting editorial, actually, just quite recently on Business Line at the end of June, focusing on a University of Cape Town researcher Haroon Borat's and his team at the Development Policy Research Institute, UCT, looking at the social relief grant that was intended, the government said, to help people to go and look for jobs. And what they found was that there was, in fact, hardly any meaningful impact on employment at all. And they suggested that, in fact, rather than spending money on these grants, you should rather spend this money on, in fact, developing businesses and so on. Because, part of the fact here, the kind of bald fact that we've got to face is that this money depends on income. It depends on the government's income, and a declining tax base. We're talking about the NHI. I mean, if anything's going to frighten people away from the country, it's something like NHI and the continuing corruption on the massive scale. With the creation of a new state-owned enterprise, as Terence says, the only function is to amass and spend money. Yeah, or to go viral. I think
viral.
Yeah, viral indeed. And that's only going to put more pressure on this declining tax base. We simply can't rely on that. It's not going to be enough, however virtuous the president thinks this is. And Terence and I agree that there's got to be a measure of compassion and concern for people who literally need this help every month. This is not a long-term solution in the absence of looking at jobs and developing the economy and so on.
Right, and I think for me that's kind of the key issue here is that the whole idea in my mind of what the social safety net should be is really the last resort to catch the people who are the worst off, who are the most unlucky, who something bad happens to them, who are in some very difficult situation, who have a broken family, something like that. The objective should be to have as few people in the system as possible, right? That's the ultimate goal of any of these programs. And yet, when the numbers of how many more people have been added to the social grant system are read out in Parliament at the State of the Nation or during the budget speech or whatever, the benches of the ANC cheer and applaud.
I know.
Terence, your thoughts on this issue?
Yeah. No, there's something perverse about that. Taking pride in how many people we have as welfare dependents. I agree with Michael. I'm in favor of social grants and social relief and free social services. I think that it doesn't mean a huge amount if those social services are not of reasonable quality. So yes, we have free education, but one of the worst education outcomes of being sort of comparable country. About a decade or so ago, I remember speaking to a lady who did freelance editing, and she said that educationists from Nigeria and Botswana told her they won't touch South African textbooks because they just think the quality is dreadful. Just so you know. What struck me about the president's letter was a turn of phrase uses often, as we build our economy, or something to that effect. Well, we're not building our economy. Sorry, let's pass amendments to the Employment Equity Act that set the stage for bankrupting companies that don't comply with a ministerial diktat. Why don't we threaten farmers through water quotas? Why don't we put all this effort into expropriation without compensation? And then we turn around with a sort of who farted look on our face, saying, well, why are our plans not working?
Talked about small business. Now, I'm old enough to remember P.W. Botha speaking about how completely amazing small businesses were. Every single president since then has, got up and said, you bet double dog dare, these are the businesses that are going to save the country. And, I can't emphasize this enough. And we are still just working towards policy certainty. Policy certainty, not good policy. So, no, I mean, seriously, get real.
Yeah, the just on the small business point is actually it is something that annoys me. It's a cliche of, and it's not just a South African problem. You can look at literally every single political campaign in the world. Is that no one is against small business except for like extremely hardcore. Maybe North Korea, they're against small business, but outside of that, like everyone is in favor of small business. But actually, a lot of politicians really aren't. And this is, as Terence has just read out, there's a great number of examples, is that it's very difficult to, unless you exempt small business from regulations, you're really not going to do much to actually help it. Michael, final thoughts on this one?
I think I must just quote the line that Terence was thinking of in Ramaphosa's open letter. And this is it. I mean, it's remarkable that he can say it. As we work to rebuild the economy, to create more employment and open opportunities for emerging businesses, we will continue to invest in the poorest and most vulnerable in our society. And yeah, I mean, that's clearly...
What's the unemployment rate right now? What was it when...
Yeah.
Right.
President Ramaphosa took over, as we do this, yeah.
And so I guess the theme of the episode today is that government fundamentally has no credibility on these issues. And it doesn't seem to have realized that and is not doing much to try and win back that credibility. There are many things that I think can be criticized about NHI, even if it was perfectly implemented, but we're not even close to that stage.
Yeah,
because we live in the world where government has no credibility. There goes my power.
Yeah.
And so it is with the social grant stuff, is that government has no credibility when it comes to growing the economy. And that is why people say the social welfare state is unaffordable or unsustainable. If we had 5% economic growth, it would be sustainable, but it's not. Okay, that's all the time we have for today. So thank you very much for listening. This is a little bit worrying for me because my power went out and we're not supposed to have load shedding at the moment. So I'm looking forward to whatever fresh problem has just caused this outage. But anyway, I hope that you enjoyed the show.
We just got elevated. So I think we're in the same...
Cold day, stage 4, wonderful. Okay, with that, cheers everyone, and have a wonderful day. We'll see you tomorrow on the Daily Fed Show. Bye-bye.